About the dangers of self-medication. Okwewa eddagala doctor lyatakuwadde. Some of us do this every day.
Most of us.
And today we're going to talk about why we do it, what are the dangers. Wali omizeke eddagala nilikuletera ebizibu ng'ate Dr. C alikuwadde. And we are privileged today to have Dr. Nwagaba from the Uganda Police Medical Department. Yes, so thank you so much for joining us. Njaga kutandika right away. Mwe waliwo kumwana yewe eddagala. Anyone who treats themselves and you just go owuliramu omutwe and you say
nze newaka eddagala.
Yes, sir.
Gamba lyagenda erinnuma erinnyo lyagenda erinnuma kanyagenda nengula eddagala mukulu kuba penikira batugamba nti penikira nga nze simanyi inaku ejjanja batekanyagenda nga bugambisa njagala penikira nampa nenja neteeka mu linnyo kati bwe namala neribanga erikakkanamu
noteeka penikira mu linnyo banomira
linnyo namira alema neteeka kanene kasigale no wekati nga linnuma nnyo naye nagenda okudda egulu nga linjokeza eno yonna bwe nga linjokeza in fact namala ewiki nga naawe.
What medicine was that? Septrin? Diclofenac.
Doctor, how bad is that?
That was expected because eddagala teekwa kubeera n'engeri gy'erikola ki how it is swallowed. Eddagala ery'empiso tosobola kulinywa ate eryakakalenda tosobola kuteeka ki ku lususu. So eddagala lyokya erimu lyokya lino eribamira libeerako n'akakooti nti olubuto lwokka lwe lusobola ki okulaba eddagala lutambula bulungi. Kati bwe bw'olyasa n'okolamu pawuda kati oba oleese asida eri kati yeyayiwa ku linnyo direct ensonga lwaki yajja.
Do you know someone who has self-medicated n'akijjamu obuzibu?
Yeah, one of my neighbor, she was even pregnant. Then she went to her boat, quinine and whatever. Yeah, and she passed out with the kid.
She bought quinine.
When she was pregnant.
It was expired, we don't know.
Sometimes, sometimes back nainanga obuzibu bw'omutwe.
Yes.
Omutwe gulumanya naye nga bwe gunnumira nempulira like nemira ku masha like I buy action. Nemira ku masha to like tablet speed. Nempulira nga siwonye saawa nyanga nziramu nga mmere eddagala ndaba omutwe gunnumanya nga banayenga omutwe ga. Ate nga like bakuteeddeko like 2 times 3. Kati nze before even 2 nze nga saawa
ng'onyunyanga
Before 2 times 2 you have already taken.
I've already taken nga mpulira omutwe gugayi.
Right.
Nogenda okwira like at the end of the day na even ewuya kamunguluze naye nga mmanyi it's because oba ddagala lingi. Mbanda banga talaba kuwona nga mpulira obulumi buwozi. Yeah.
Right.
One of the causes of self-medication is, I would say, lack of access to the qualified staff. So because someone has no access, then they prefer to do their emergency treatment. Our government can so kenguleyo kano, then when nafuna ebiseera oba
I'll go see the doctor.
or money, I go and see the doctor. Now, in the right sense, in the right procedures, no one is supposed to buy medicine without a prescription. But because people in the drug shops, some of them may want money, ekyo tebakigezaako okugamba nti bakiteeke mu nkola. Ojja n'oyagala tablets 3 ngeza malaria oli nakola ki nazikuwa. Even one, you say I want to buy one chloramphenicol, the common names, one fancida, najikuwa. Naye there is no law which accepts that.
Well, let's take a look at Dr. Nwamanya Emmanuel, and we did an interview with him before this. But take a look at this, and when we come back, we'll look at what should be done.
People do self-medication, I guess, because of different causes. One, it looks convenient. So a person finds it easy to go and buy the medicine. Two, it is cheaper. It does not involve costs of going to see a doctor or a lab person. So it also becomes cheaper for them. But three, lack of information also. If you do self-medication, one, the danger is that you are not sure what you are treating for is actually the correct illness. Meaning you can take a wrong medicine for a wrong cause. Another danger is that some medications are quite dangerous to individuals. So if you take a medicine, a certain type of medicine, where you don't know the side effects and the complications, you are likely to get dangers that you don't know. But another danger is that you are likely to have half-baked treatment. Instead of getting a dose that can take you 5 days, you opt for 3 days. So you get halfway treatment. And that treatment actually will increase the dangers of that disease to the population. Self-medication truly contributes to drug resistance. I would urge all members of public that where you feel you have an illness, contact a health worker, and then we shall avoid all the dangers of self-medication.
You talked about us contacting health workers, but information. The Pharmaceutical Society of Uganda has 476 licensed pharmacists. Licensed. That is for 100,000 people. There is one pharmacist.
naye tukimanyi mu neighborhood obeeramu ne bu drug shops nga 5 kamwocha olubala ofunamu drug shops nga 5.
What then do we do in such a scenario where pharmacists actually naitali available? Consultation ya mtwalo 1.5 and it's quite expensive.
Every 3 to 5 kilometers there is a health facility. So it's better take that person there and they look at that.
Right.
Of course, we said poverty. Poverty, it's a program that can be fought by other government departments and other players in Bangkok. So the more people get more economically empowered, then the area they get out of that practice of self-medication.
Right.
However, we have found that people who self-medicate actually are not the uneducated. And they are not the poor. Yes.
The rich are the ones who...
People who are, by our standards, our somako, they self-medicate more than the real illiterate.
Kubanga atasoma abatya. Okay. So before you get out, in fact you can come.
Self-medication is very common, as you are saying. If you have like a child, or if you have a family, you are supposed to have medicines in the house stock.
First aid box.
Yes. So before you go to the doctor or whatever, that's when you what?
You've exhausted
when the situation becomes dangerous, that's when you go to what? That's when you go to the doctor or to the nearest clinic. But otherwise, you are supposed to have medicines at home. So most of the educated people, you will find they have medicines at home. Even you'll find there are even some schools where they don't even have these nurses and so on. So they just put people there, the matrons or the what are the people who are what? Giving medications to the students. So you find that is very common, moreover with the educated people.
Yes.
So that is very true.
Okay, thank you so much.
Thank you.
Linda kona soka fulume mko. Wali avamu kuspia. Sembera kausi.
Katubatoa.
There is always room for
There's always room for one more.
Good morning.
Mwebale twegatako bannaye. Ngate munayingira tubadde twogera about self medication. Okwewa eddagala okulira obulumi newewa eddagala nga togenze mu ddwaliro. Kyali kikutuuseeko. Wali ofunyemu obuzibu. Okikola nnyo?
Kikola.
Kya bulijjo.
What I mean? When some weakness, I buy medicine.
Do you always get relieved, or have you ever had a problem with self-medication?
But let me ask you something. Why do people do it? Yet we know that you must go and go to a health worker, then you're prescribed. There's medicine prescribed. You go to a clinic and you say, please give me this from a doctor. but we still go on and do it. Why do you think that is going?
Fact in the nose, and because of the poverty, work sangula yo some panados and at a cheaper price than going to the clinic. I spend more in the clinic, so it's just very easy for me to go and buy medicine of 1,000, 2,000. Then though sometimes it's dangerous, but it keeps us situation.
Yes,
the situation anyway.
What are the most common medicines that we play with? That we usually play with? You can say, can we come? Yes.
Tunayoga panadol, gundi, magnesium, headaches. Mtoto sukuru wanogamba kangenefu leo headaches banusunga bitano.
Olaba waliwo ne headache kitegeeza
Action.
Action.
Maybe we are also going for a strong one, like Cotem nowadays. Yes. They say it's very strong. So people normally go and buy it, take it as a prescribed by the doctor, and people are really getting you.
Cotem, you take it for what?
For malaria.
You just go and buy Cotem?
Yeah, because the order is four. I think then the last, I think 12. I can't remember.
Let me ask you, how do you know you are suffering from malaria? How do you feel that you are suffering from malaria?
Yeah, normally though it would be risky. I understand your point. But normally when we get temperatures, joint pain, headache, I just go for that.
Perfect.
I just decide myself. Though, in fact, I've heard in Kenya, they don't allow that such kind of whatever. Maybe here we need also to be sensitized about that, and maybe about the poverty, which is extremely beyond.
Doctor, and I want you to come in here. As long as you can see.
There's a doctor behind.
Yes, there's a doctor behind.
So
you're in trouble.
I'm in trouble.
Now, doctor,
maybe
you can see that
there's no police person here.
He's a police
Sorry.
He's a passenger.
No, it's a joke. I know it's a joke.
At this time, he's a passenger.
Doctor, you see how we have become our own doctors. We can diagnose the disease. When I have joint pains or your malaria, period. How then do we come out of that situation?
Okay, thank you. I agree with his submission. One, common things occur commonly. In Uganda, we think that malaria is the commonest disease. Headache, temperature, then people think it's malaria.
Yes.
However, that's about 10% of the people who have that. About 10% have malaria. Now, I had his observation that he takes later on. You can actually stop after 2 days of Cotem. Because when it was not malaria, 2 days, you really feel fine.
Yes.
Then you forget about the third dose. Now, if you have gone to the lab, to the doctor can say, this is malaria, bakuwa encouragement. Malako dose yo. Yes, atopta malako dose, chilete dagala obutakola. As we talk of now, even Cotem is becoming a
resistant.
At first, we had quinine, we had chloroquine. Because of abantu nga batweetinga dose tebagimalayo kati omusujjani gujimanyira enaku zino you treat it and
chloroquine is potea.
We have actually stopped using it.
Yes.
Now the same practice is going to Cotem.
I like what you say. And I thought about, for example, Omami Yavudemia mentioned in the liver failure, damaging organs. Is it also because Katife, by the time we go to the hospital, when it's worse, there's nothing to say?
Yes, thank you. Now, in terms of how the drugs can complicate people, kakati ugenda mudwaliro olina malaria ne gundi naye alina malaria naye sex yamwe, your age, your past diseases you have, determine the medicine the doctor will give you, even when all of you suffer from malaria.
Waliwo eddagala erikolera nga terinkolera
omukolera oli naye mwena mulina malaria, so temusobola kutwala ddagala lyerimu ogw'embeera yamwe nga tefaanagana naye ogenda ku self medication.
If you're at home and you're also just joining us, send your questions to 6565. Go to our Facebook page, which is Minibuzz Uganda, and tweet us at Minibuzz Uganda. We're talking about the dangers of self-medication. Omwami diclofenac ya moche erinyo. I still don't understand what diclofenac umteka
anti obulumi anti yasalawo naga administer nga injection nateeka ku linyo nagamba wano we wanuma kateekeko diclofenac
Nelimuocha and he learned.